Hi, I'm Ryan Meili. I'm a family doctor in Saskatoon and a graduate of the College of Medicine at the University of Saskatchewan. And I clearly remember as a student the first time that we learned about the social determinants of health. And some of my classmates and me, we were a bit taken aback. We were there to serve health and we thought being doctors was the most important thing we could do. And then we learned that it's actually how much money people make, how far they went in school, whether they have a decent place to stay that makes the biggest difference in their health. A bit taken aback, but really not surprised when you think about it. It makes so much sense. But it had us thinking a little bit differently about our role. And then you take that concept and you sort of park it as you study for the rest of your exams. It's only later when you actually start to see patients that you realize how much of an influence that has when you're working with a patient who has diabetes that they're not able to manage, or HIV, or struggling with addictions. You realize how much their social circumstances are at the root of their illness and how important it is to understand those social circumstances in order to be able to treat them properly, in order to really be able to help them. And then as you think a little further, you start to realize that those social circumstances are deeply affected by political decisions that become public policy. Some of those public policies are very positive, things like a social safety net that help to support people in times of need, but others are very negative. Policies in the past, like residential schools, which we still see the effects in so many families, and current policies like social assistance policies that don't give people enough to live on and actually are not generous enough to help them get out of poverty. So that's why I've continue to work as a physician with communities that are in the greatest need of help, work with marginalized communities, but also been drawn more and more to get engaged in public policy through Upstream and the work that we do to try to mobilize understanding and action on the social determinants of health. And then in a recent change, I've actually run and been elected to the Saskatchewan legislature, where I hope to bring these ideas of action on the social determinants of health to bear on legislation in order to help people be healthier in the first place, rather than spending all of our time reacting to illness.